So we're going to talk about foam rolling, specifically a static foam roll, which is best used to treat chronic pain from things like trigger points. So a trigger point, a knot or spasm, kind of cramp in the muscle. You can do it all over the body, so lats, quads, kind of more of our broad tissues are the easiest to access with a foam roll. The idea here is, again, trying to treat chronic pain through a static hold over the trigger point. You can use the foam roll, or if you prefer, for certain areas that are easier to access, you can use something like a lacrosse ball. So a lacrosse ball will go on the floor, or a tennis ball that can go underneath, and you can access some other areas that are maybe more difficult to access with the foam roll, just because they're smaller regions such as the hips, the shoulders, some of the areas on the back are better. What you're going to do is identify the trigger point, which you can identify by rolling over and finding a spot that's uncomfortable to touch and should be familiar in that discomfort. And then as you stay on that position, you're just going to wait for your body to slowly relax over that trigger point. As you do, you'll notice the pain does start to decrease, does start to get less uncomfortable. You do start to settle into that position. But in the beginning, you will cringe a little bit. You will struggle to relax. It is uncomfortable, specifically when you find ones that are relevant. But as you hold, you're trying to relax the tissue. Again, 1, maybe up to 2 minutes you could take per spot, trying to alleviate these trigger points. But a key feature of trying to relieve chronic pain, a lot of our muscle pain lives in these trigger points. Check out our additional videos to look specifically at each muscle.